Well, maybe we'll get started since we have a big group and a lot of things to talk about. I want to welcome you all to the February meeting of the Southern California Environmental Health Science Center. We have a very august special guest presenter today, and I'll defer that introduction in just a minute. I do want to remind you that this is a monthly seminar, the first Friday of the month. And just to whet your appetite for next month in March, we have another internationally renowned figure, as Phil Landrigan is. This will be Howard Frumpkin from Professor Emeritus of the University of Washington, who has had quite a stellar history in terms of doing work in a number of areas. Former dean of the Washington School of Public Health, director at the National Center for Environmental Health (CDC). So Howie will be here in March. So get that on your schedule in terms of what you want to do the first Friday morning in March. But today it's a great pleasure to have a guest here. But I'll defer on the introduction, and instead I'll get to introduce the department chair, the chair from the Department of Preventive Medicine, Howard Hu, will make the introduction of a longtime friend. So Howard.
Yeah, so it's such a pleasure. And in particularly for the young folks who are in the seminar, and we have a lot of great young scientists here. Dr. Landrigan is one of the giants of our field, environmental health, trained as a pediatrician, as an epidemiologist, and he has had a stellar career at the Centers for Disease Control. And I remember back in the 1980s when I was a public health student, the great disappointment at Harvard when they couldn't recruit him to the faculty there, and he ended up going to Mount Sinai to chair the department there of preventive medicine, and built this tremendous unit there that's like ours, had a children's center and an NIEHS center. And not only has he been a traditional academic with over 500 papers and has been elected to the National Academy of Medicine, but he's also been one of the great advocates. And back in the 1990s, he worked with Herbert Needleman to publish some of the first books and monographs on protecting children from environmental health and how they were especially vulnerable to the toxicants that we worry about. He's led some of the great efforts, including writing op-eds and testifying in Congress that led to the phase out of lead from gasoline, some of the first controls of pesticides against children. And he's been a wonderful leader and trainer for young scientists for decades. And on top of that, he's also part of the Naval Reserve. And I remember bumping into him when he was on his way off to Africa to do something, and he was still a practicing pediatrician. And he does it all. And I think that gives him a wonderful perspective, both from the perspective of kids, but also society, on what are the things that threaten our existence and our development. And we're going to hear some of that today. And most recently, I've had the great privilege of working with Phil on this initiative to try to leverage the commission that he and Rich Fuller organized, that he'll talk about today, Lancet Commission, to try to improve the global estimates of impacts of environmental toxicants. And I'm sure we're going to hear about some of that today based on his new perch at Boston College. So please welcome Phil Landrigan.
Howard, thank you very much. I appreciate the generous introduction. It's a real privilege for me to come back to your department. I've had so many friends in that department over so many years, most especially John Peters and all the folks that John brought in, Frank Gilliland, Quincy. It's been such, your place has been such a powerhouse for so long. And special shout out to John Freunds and Andrea Ricco. John was one of my mentors. Much of what I know about advocacy, how to translate science into policy, I learned from the former Chicago 7. So it's really a treat. All right, so let me get to work here. So the the main argument I want to make in this talk, and I suspect it's an argument that I can get through very quickly with your group, because this is the world you live in, that the environment is a powerful determinant of health and disease. And while we who do this work know it, it's something that most people, most Americans don't really think about, and most doctors, most nurses, most health professionals don't really think very much about the links between the environment and human health. I mean, we have a Department of Health and Human Services. We have the Environmental Protection Agency. Once in a while, they talk to each other, not that often. You think about the newspapers, the medical writers talk about the latest cancer treatment or the newest stent, and the environment writers talk about polar bears or salmon. And again, there's, in the media, there's minimal connectivity between the two. Maybe more of late with concern about climate change, but it's still not what it should be. But when you think of it, there's been this profound change in patterns of disease over the last century, and at the same time, a profound change in the environment where we live, with air pollution down by 70%, lead down, and then thousands of new chemicals having entered the environment. And in the USA, this transition began around 1870. I always use this slide, I probably overuse it, but it comes from the City Health Commissioner's office in New York City. As we all know, New Yorkers are soft-spoken, rather modest people, which is why the slide is called The Conquest of Pestilence in New York City. But there's several very potent lessons you can extract from this graph, which shows the crude death rate in New York from 1800 till almost the present. The first is that back in the 1800s, the background death rate, not even considering the spike, was substantially higher than it is today, because average life expectancy back then was only about 40 years, 42, 43 years, something like that. Then superimposed upon that already high death rate, which reflected infant mortality, maternal mortality, and childbirth, lots of deaths in early life from infectious disease. Superimposed upon that are these big spikes that correspond to the epidemics that swept periodically through the city. The one that I identify with most viscerally, 1849, when cholera came in, that was the direct consequence of the emigration of my ancestors from Ireland, who came into Boston, New York, other port cities on these terrible ships that were infested with cholera. They brought cholera with them into the city. And in some of those years, the death rate was as high as 50 per 1,000. So in other words, 5% of the city died of infectious diseases in some of those years. That would be, in today's New York, of something like 8 million people, that would be 400,000 deaths in a single city in a single year from infectious diseases. Bad as COVID is, it's hard to imagine how bad that must have been. But anyway, the city fathers finally got together, and they did the kind of thing that I think may be, hopefully, happening in America today, is they got together across broad sectors of society. So the health professions played a part in it, but it was also business leaders, political leaders. And they said, we've got an existential crisis on our hands. We're going to do something about it. They formed the Board of Health in 1866. Over the next 15 to 20 years, they undertook some massive public works. They built the Croton Aqueduct system. They constructed sewers. They passed legislation that set some minimal standards for how many people could be in a house, so-called tenement laws. And all of a sudden, starting about 1870, long before penicillin, a century before the invention of the renal transplant, 50 years before the first ICU, you had this tremendous decline in mortality, so that even the 1918 influenza, which is this peak here, horrible as that was, pales in comparison to what preceded it. And then all through the 20th century, there was some modest declines, but nothing like the impact that those massive public works, that those man-made changes in the environment had. So if you have any friends who are engineers and you have a medical background, be a little humble, because those guys have probably saved more lives than we ever will. So what were the forces driving that? Well, I think they're reasonably well known. On the positive side, clean water and sewage disposal I just mentioned, as well as nutrition, immunizations, and a structure. And on the negative side, all of these bad lifestyle things. But what doesn't get talked about enough is the impact of environmental factors on that transition. I mean, even today, the WHO has a whole department in Geneva focusing on non-communicable diseases, and all they talk about are the lifestyle factors. And only recently they've listed air pollution as a risk factor for NCDs, but unlike the lifestyle factors, they've not yet set targets or timetables or anything to do about air pollution. I think they mentioned it to be polite to get me off their back. But certainly the world of environmental science and the world of disease prevention are still way too much separated in too many parts of the world. So in the aftermath of the epidemiologic transition, we've got the NCDs going up. So big increases in asthma, childhood cancer, mortality is down due to treatment, but incidence is up. Brain cancer, same. Testicular cancer, same. Approximate doubling in the incidence of hypospadias and related abnormalities on descended testicle. Sharp increases in autism and other neurodevelopmental problems, probably partly reflecting diagnosis and better awareness, but almost certainly also a biological substrate, and obesity with all of its consequences. That's obviously a litany that's familiar to all of you, but it's I just wanted to run over it to set the stage. So that raises the question, which so many of you in your department spend your days trying to answer: what's the contribution of environmental factors to these increases in NCDs? And that was the question that impelled us to form the Lancet Commission on Pollution and Health that Rich Fuller and I formed in 2014, and we got Lancet's blessing in 2015. And it was then a 2.5-year effort to produce the effort. And the goal was really to figure out, okay, on a global scale, what's the impact quantitatively, what's the impact of environmental factors on human health? And this is the definition we use for pollution: material introduced into the environment by human activity. So in other words, it's not volcanic ash, for example. We would not have included wildfire smoke, although I must say in the aftermath of the events of the last couple of years, I might like to rethink that, but we didn't at the time. And the damages health. Just as an aside, I think it's fun to point out that this background picture here is not somewhere in Asia, as you might imagine. That's actually Cleveland, Ohio, and that's in 1968. That's a couple of blocks from Cleveland Metropolitan General Hospital, where I was an intern that year. And we had a long corridor down that hospital, an interior corridor, and on some days it was not possible to see the length of the corridor, which might have been several hundred yards, because there was so much smoke infiltrating in through the walls from the nearby steel mills. It was really quite amazing. Cleveland was also the city that gave us the Burning River, but that was a year after I had moved back to Boston. So that was our definition of pollution. And in the Lancet Commission, we basically used the IHME Global Burden of Disease study as the basis for our calculations. And we took advantage of the fact that Christopher Martin and all of his people had already attributed certain diseases to environmental exposures, for example, air pollution and COPD, air pollution, and various forms of heart disease, air pollution and stroke, asbestos and its diseases. We took advantage of all those exposure disease pairs that had already been vetted by the GBD people and that already assigned quantitative numbers to them. And that's how we developed our estimates of pollution-related disease and death. Also at that time, WHO had their own attributions, which they've since stopped doing. They've just basically given ground to IHME. But the two data sets weren't identical, but they were close, which gave us some comfort. Something we did on our own, which wasn't from the IHME people, was we divided pollution into traditional and modern. So traditional was indoor air pollution, household air pollution, and contaminated drinking water. Modern was ambient air pollution and chemical pollution. And I realize that that's not a clean distinction, but it helped us to put things into bins. The economic estimates were led by Maureen Cropper, who's the chair of economics at the University of Maryland and a member of the National Academy of Sciences. We actually, Ken Arrow, the Nobel laureate at Stanford, was actually a member of the commission right at the very beginning, but got sick and died partway through. So it was Maureen that led the analysis, and the methodology is basically what they call the fractional contribution methodology. You figure out what fraction of the disease in the population is caused by the environmental exposure in question. That enables you to calculate the actual number of cases that are due to the exposure that you're interested in, and then you pull in health data, health cost data, and labor cost data, and figure out the health costs and the labor costs that result from pollution, and you can come up with economic estimates. It's important, I should mention, that all of the estimates of the burden of disease, the economic estimates, they're all lowball estimates. We very deliberately erred on the side of conservatism. And so, for example, the GBD estimates of how many cases of disease and death are due to pollution only consider those exposure disease periods where IHME has a high degree of confidence in causality. Howard was there at a meeting a couple of years ago up in Seattle, and I got in a big fight with the people at IHME because they would not consider subclinical lead poisoning, the loss of IQ from low-level lead exposure, to be a disease, because they said it wasn't clinical enough for them. Even though they agreed the epidemiology was strong, it wasn't clinical enough. So there's missing stuff in here. And likewise, the economic estimates are conservative because they're based strictly on the exposure disease pairs that IHME is willing to consider. And there are also some conservative assumptions in the economic analyses themselves. So here's the bottom line. This is the headline that came out of that 2.5-year effort, the Lancet Commission, that pollution in all its different forms killed 9 million people in 2015, which was the data year that we were working with, which is 3 times more deaths than the big infectious diseases and 10 times more deaths than war, terrorism, all forms of violence. It's a huge, and here it is in perspective versus Ebola, war, road accidents, malnutrition, drugs and alcohol, AIDS, malaria, TB, salt, tobacco, and there's pollution. The only 2 risk factors that kill more people than pollution are dietary factors considered in their totality and hypertension. With regard to AIDS, it's worth pointing out that 10 years ago, the number would have been up around here. And the reason that it's not there, but instead here, is that we mustered the societal will, we got the resources, we put in place programs like PEPFAR, which was probably the best thing that George W. Bush ever did, and brought about massive reductions in mortality from AIDS around the world. And I take that as an object lesson for what we could do for pollution if we had the political will. Just a few quick pictorial slides. Here's ambient air pollution. This is New Delhi during November, December, which is their worst season of the year for ambient pollution. Household air pollution. This is also from India, but it could have been Guatemala or many places in rural China or sub-Saharan Africa, where the source of the pollution is an unventilated or poorly ventilated indoor cook stove or heating stove. Polluted water, which is a combination of biological waste, human waste, plus the chemicals that people dump into the water. And then all kinds of heavy metals. This is the poster child for heavy metal poisoning, lead poisoning in a secondary battery plant. You can see the gentleman there with no respiratory protection whatsoever, using a little hammer to break up old batteries, those to separate the lead from the plastic. The batteries will then be put into a furnace, secondary smelter like your Exide smelter there in LA, melted down and the lead recycled. Chemical production is the big it's really the big unknown in the global pollution story. I mean, chemical production has just skyrocketed in the last 60 or 70 years. The annual growth rate is about 3%, so that translates to a doubling time in global chemical production of about 25 to 30 years. That's all chemicals, pesticides, fertilizers. Just a massive increase of material that just wasn't in the biosphere when John Freund's and Howard Hu and I started our lives. And what happens is these chemicals are introduced with great fanfare. The chemical industry comes up with something clever. The chemical engineers think of good products to put it in. The marketers come up with beautiful sayings like the best things in life come in cellophane, better living through chemistry. Here's a picture of the DDT truck. That's Jones Beach, New York City, probably around 1950, spraying DDT to keep down mosquitoes and the kids running through the cloud. I can remember I grew up in Boston about that same time. I used to get really angry at my parents who would not let me go out and run behind the DDT truck when it came down our street like some of the other kids. Well, I'm still alive. Here's another one, synthetics. They spell a better life for you, Union Carbide, the folks who brought us the Bhopal explosion in India. And this is the story. The chemicals are brought to the market. They're not scrutinized, they're not tested, nobody does any safety analysis. And then time and time again, they cause disease, they cause harm to the environment, like the fluorocarbons that almost destroyed the ozone hole. It's a recurrent story. We just don't seem to learn from the past. Here are some macro level statistics on pollution and non-communicable disease. So despite the fact that pollution is well known to cause pneumonia and dysentery, which is basically the links between pollution and disease that I learned about when I was a medical student, nowadays, 70% of the deaths are due to NCDs. So it's a quarter of cardiac deaths, quarter of stroke deaths, half of COPD, and 40% of lung cancer. Big numbers. There's enormous injustice in the global distribution of pollution and pollution-related disease. So 92% of pollution-related deaths occur in poor countries, with the largest numbers in vulnerable subpopulations like children. And in every country, including our own country, it kills the poor and the marginalized. We still have approximately 200,000 deaths due to air pollution alone in the US each year. So even though we're doing a lot better than we were before Richard Nixon signed the Clean Air Act in 1970, we have not ended the problem, which I hardly have to tell you folks who live and work in LA. And here's a map showing the same thing. The darker the red, the higher the population attributable fraction. And in the most severely affected countries, some of those Central African countries, Afghanistan, more than a quarter of all, or more than 20% of all deaths in the country are due to various forms of pollution. Here's the economic analysis, and it's worth taking a minute to frame this to help you understand how we did it, because I think this is an underutilized tool in policy analysis, trying to translate epidemiologic data into public policy. If you can come up with economic costs, it's powerful. And the reason is that a lot of policymakers aren't bad people. Some of them are, obviously. We've seen a few recent examples. But a lot of them are just unschooled in science. They've got too much on their plate. They've got too many decisions they have to make at the same time. Let's take it to a state level. A governor has to build highways. He has to build hospitals. He has to support schools. And then the public health people come and say, well, we had 2,000 deaths in the state last year from an environmental problem. And it's not that he doesn't want to do something about it, but he's got all these competing priorities. And in that arena, how does he or how does she put a metric on health to figure out how important it is relative to the other issues that are confronting him? And the answer is, if you can put honest, not inflated dollar figures on disease, that can go a long way towards cutting through the murk. And one of the problems when it comes to pollution is that affected industries like the electric power industry can tell you pretty much to the nickel how much it costs them to control pollution. They know what it costs to install a stack scrubber, how much it costs to run it every year. And by contrast, the costs of disease are distributed. They're distributed geographically. They're spread out in time. It's hard to pick them up. And moreover, they're externalized. So they don't the industry that causes the pollution doesn't have to deal with the cost of disease. It's not on their budget. It's externalized. It doesn't really affect the budget of EPA, or the State Environmental Agency. Instead, these costs they're buried in hospital costs. They're buried in labor statistics in terms of lost productivity. Now, unless you have some really smart economists and you find a few dollars to support them, these costs are simply cannot be captured. But when you do capture them, they're big numbers. And we calculated that in rich countries like the United States, pollution-related disease accounts for 1.5% of healthcare costs. And in poor countries, we got the best data that came from Sri Lanka. Fully 7% of the healthcare expenditure was going to treat pollution-related disease. And then on top of those healthcare costs, you have what are called productivity losses. And that's a simple concept. If somebody is taken out of the workforce because of premature death, or their ability to work is diminished or ended by disease, that's a productivity loss. And economists know how to value that. You can also apply the productivity loss concept to loss of IQ. If a child loses IQ and is less economically productive over the course of her lifetime, you can monetize that and add that into the figures. And then there are also environmental costs, but we didn't try to calculate them. We did not have the tools. We didn't have the right people. And the bottom line that we presented to the international agencies is that these costs are so great that they can undercut national trajectories of development. We've just recently completed a big study of air pollution in India that was separate from this global analysis. And in 2019, air pollution killed 1.65 million people in India, almost unimaginable number. And it had an impact on the GDP of about 1.5% when you include healthcare costs, which is a big hit in a country that's trying to grow its economy by 3 or 4% per year. It basically takes out about a third of their anticipated growth. Okay, the link between pollution and climate change is very important to make. And pollution and climate change, especially air pollution and climate change, are joined at the hip. The common source of both is combustion of fossil fuels, which accounts for pretty much all of the particulate pollution and virtually all of the SOx and NOx pollution. But the good news is the whole concept of co-benefits, that any action we take to mitigate climate change is going to prevent pollution and vice versa. It's fascinating that the Trump people just didn't want to hear anything about co-benefits because they didn't want to hear that this control would actually improve the bottom line in two ways, because it might actually make pollution control appear to be desirable. Fascinating reverse logic. So you've probably mostly seen this stuff, but this is the information on atmospheric CO2 levels. And we haven't had CO2 levels as high as we have today since there were dinosaurs around. It's really, we're totally into uncharted territory. Remember, humans have probably been around for perhaps 200,000 years, this long a time in the fossil record. But human societies, the rise of cities and so on, is really only the past 10,000 years, this little blip in geologic time, this little period of time when temperature and sunlight and oxygen and CO2 levels were all in perfect balance like Goldilocks, and human civilizations have been able to flourish. We've been able to do epidemiology and do heart transplants and explore outer space. We could bring this all down. Humans will probably still be around. Life on Earth will still be around. the planet itself will still be here. But these existential threats like climate change, like pollution, could bring down organized civilization as we know it, just as the Roman Empire collapsed, the Maya, the Inca, other ancient civilizations. And of course, here's the temperature rise. It's on a much different scale, obviously, than that. But starting about somewhere in the 1800s, early 1900s, with the burgeoning of the Industrial Revolution, the burning of coal, fossil fuels, oil and gas, this steady increase in surface temperature of the Earth. And I suspect many of you will be familiar with the Johann Rockstrom's work, the concept of planetary boundaries, that if you think of the Earth as a spaceship, there are a number of systems that have to be in proper balance. It can't be too hot, it can't be too cold, there can't be too much oxygen, there can't be too little oxygen, and so on and so forth. And he defines 9 of these boundaries: climate change, ocean acidification, stratospheric ozone, nitrogen and phosphorus cycles, global, what's this? Oh, it's freshwater use, change in land use, biodiversity loss, air pollution, and chemical pollution. And he says that we're already beyond safe boundaries on nitrogen and biodiversity loss. We're getting there with climate change. We're starting to get there with some of these others. And in the case of air pollution and chemical pollution, they didn't try to come up with an estimate because they felt they didn't have enough data when they did this thing about 7 or 8 years ago to determine where we are in relation to these hypothetical boundaries. But I think the real notion here is not so much the individual boundaries, even though they're important, but the whole notion that the Earth is a spaceship, that there are a whole bunch of operating systems that have to be kept in balance. And in this day and age, in this so-called Anthropocene era, when humans have become the dominant species on the planet, we are in danger of transgressing a bunch of these boundaries, and we do so at our peril. And the consequences of climate change: violent storms, rainfall, rising sea levels, melting ice caps, flooding, droughts. Another point of intersection between climate change and pollution is that climate change will magnify the impacts of pollution on human health. So when you have heat waves, the air pollution gets terrible. When you have floods like Hurricane Katrina in Los Angeles, we saw up close and personal, where all sorts of chemicals were busted loose from factories and got into the drinking water. And you have more pesticide use. That's been quite nicely documented in several countries. Rising sea levels, that is New Orleans after Katrina. And we know, I don't think it was appreciated as widely as it should have been at the time that was climate related. And I think most people now, most thinking people, understand the link. There'll be multiple effects on coastal populations, certainly in a city like Boston, where I am. People have done very careful maps of Boston and other cities. The real estate people look at them very carefully because a lot of houses are built in places that are going to be underwater in 10 or 20 or 50 years, depending on what projection you use. And that's going to have economic impacts and could have health impacts if we don't plan for it properly. Loss of coastal land, contamination, and then you have, especially in poor countries, where people can't just afford to move inland and go to a place like Worcester or Springfield. They're going to just migrate and go from Africa to Europe, or from the Middle East to also to Europe, or from Latin America to North America. Wildfires, you know much more about those than I do. In countries of Asia that rely upon snowmelt to provide water for the rivers, as the glaciers dry up, so do the rivers, with predictable consequences of drought and famine. And increased waterborne disease is certainly another consequence of both pollution and climate change. And a direct consequence of climate change and global warming is the expansion of the ranges and lengthening of the infected seasons of all sorts of vector-borne diseases, malaria, dengue, chikungunya, Rift Valley fever, a whole slew of them. Some of the interesting studies, fascinating studies done in Africa on Mount Kilimanjaro, what they've documented very clearly is that every year the malaria carrying mosquitoes move a little bit higher up the mountain as the world gets a little tiny bit warmer. Environmental refugees. So our Lancet Commission made a series of recommendations on how to move the world forward. A key message that ran through this was the notion that pollution can be prevented and climate change can be mitigated. That these are not inevitable consequences of human progress. We actually could blunt, if not completely control them, at least certainly blunt some of the worst consequences. And the proof of principle, the pilot test, if you will, is the fact that countries like the United States, Western Europe, Japan, Australia, have controlled their worst air pollution, controlled their worst water pollution. We've still got a ways to go, of course, but we have come up with a toolkit which is based on law, on policy, enforcement, technology. The precise mix varies from country to country depending on the legal system, but we absolutely know how to do it, and we have done it in this country. And we've also in the last 3 years had the opportunity to see what happens when you back off this. I was just telling the faculty meeting earlier this afternoon that we were about to publish a paper with a group of about 40 other people looking at the impacts of the Trump rollbacks, and we're calculating that about 22,000 excess deaths have occurred in the United States from environmental and occupational rollbacks alone. Nothing to do with his dismantling of Obamacare or of nutrition programs or reproductive rights. Just 22,000 deaths from more fine particulate air pollution, more black lung disease, more silicosis, more injuries in industries like mining. And our commission said these solutions are ready to be taken to global scale, and they'll have many, many benefits. So the key to it all, in my opinion, is going to clean renewable fuels. And the good news here, which I hadn't really appreciated myself until just a year or two as I got into the reading of this, is how rapidly renewables, especially wind and solar, have come along. So global generating capacity, electric generating capacity from wind and solar has quadrupled in just a decade. It's now, as of a year ago, it amounted to 18% of the global energy market was from wind and solar. At the same time, the unit cost of producing electricity from wind and solar has fallen drastically. In the case of solar, the unit cost has fallen by more than 80%. And in the case of wind, it's fallen by about 45 or 50%. So that investment in renewables is just increasing exponentially. Goldman Sachs has a massive portfolio now that they're planning to put into renewables in the next decade. And I think you're going to see defunding of fossil fuels. I think it's going to become economically just non-viable, for example, to drill in the Arctic refuge or to do some of the undersea drilling that people are talking about. At the same time, though, of course, the fossil fuel industry is not standing still, and they're moving as fast as they possibly can to sell the lie that gas is a clean fuel. It's a bridge fuel in some future, but that future is a long way away, so let's not worry about it. And up our way here in New England, they're rapidly trying to build up the gas infrastructure. They're trying to lock cities and towns into gas for years to come before they get overtaken by wind and solar. It'll be very interesting to see how this plays out. Biden made an announcement just yesterday that he's going to do away with the $40 billion per year that are provided in federal subsidies to the fossil fuel industry. That's going to do a great deal to immediately slow down the expansion of fossil fuels. And if he diverts even some fraction of that money into incentives for renewables, I think you'll see a sea change remarkably quickly. And it all speaks to the importance of leadership and political will in bringing about these changes. Another thing that can't be overemphasized is the transition to a certain circular economy, getting rid of waste, especially products that are designed for single use, like single-use plastic bags, single-use straws, plastic wrapping. 10 million tons of new plastic now get into the oceans every year, and most of it is one-time plastic. And once it gets in there, it's basically a persistent pollutant that lasts for decades. People sometimes say, what about nuclear? Why couldn't we go to nuclear? It doesn't pollute the air. That's mostly true, except when plants go up. But even apart from occasional disasters like Chernobyl or Fukushima, there are some very important negatives that attend to nuclear reactors. First of all, they're amazingly costly. They require huge capital costs, much more upfront money than wind and solar. They concentrate energy in the hands of a few, whereas wind and solar democratize energy. You've got the intractable problem of nuclear waste. The stuff, for all practical purposes, is immortal. Nobody knows where to put it or how to get it there. There's the national security issues. So I just, even though I know some people say it's still possible to bring in nuclear, I beg to differ. I just don't think it is the way forward at all. It just creates more problems than it solves. And the economic argument in favor of controlling pollution and going to renewables is very strong. EPA under the Obama administration did a calculation that every dollar that has been invested in air pollution control since the passage of the Clean Air Act in 1970 has yielded $30 in return. This is really an amazing return on investment. Most of that saving is from disease prevented and productivity losses averted. And another example that I was involved in was the removal of lead from gasoline, dropped blood levels in kids by more than 90%, contributed to a 5-point increase in the IQ of every child born since 1980. That increased IQ translates into increased lifelong economic productivity, and that turns out to be billions of dollars. A number of years ago now, Joel Schwartz and Dick Jackson calculated that the annual economic benefit in the United States, just in the US, of removing lead from gasoline is $200 billion, just in this country. And since 40 years have passed, since we took lead out of gasoline, multiply 200 billion by 40, and you get a total economic benefit in the United States of $8 trillion from the single action of taking lead out of gasoline. Those are numbers that even politicians can understand. This is a graph that I think came out of your department. Was John Samet still at USC when he drew this? I think he was. This was in the New England Journal a few years ago. So this covers obviously the years 1970 to 2017, I think. Air pollution has come down by 70%. And at the same time, this green line here going up, the GDP has increased by 250%. So anybody that tells you that controlling pollution is going to kill jobs, destroy the economy, is just not dealing with facts. So here are the conclusions. Pollution and climate change are soluble problems, but as we move forward to solve them, we have to put the protection of human health and the advancement of equity at center stage. The gaps between rich and poor, the haves and the have-nots are not sustainable, and they actually contribute to pollution and climate change because people at the top of the heap have the foolish notion that they can somehow buy out of societal devastation. And this quote that economic growth that accepts pollution, ignores climate change, and makes health an afterthought is not sustainable and it's not just. I strongly believe that leadership is key. Obviously, the people, all the people with a capital P have to be involved. They have to be behind the leaders, but nonetheless, leaders are important. They can do great good and they can do great evil. And we've seen both in this country in the recent past. And data are essential. and funding. You got to have funding, as anybody who chases grants knows too well. So we have this Global Observatory on Pollution and Health at Boston College that we started up when I came here in 2018. This was a direct offshoot from the Lancet Commission on Pollution and Health. One of the recommendations was that such an observatory be established. And the goal is to do studies that look at pollution, look at climate change, always with a strong focus on health. Disseminate these findings widely, help countries to prioritize and collaborate with good people around the world to make this happen, because these are global problems. They require global collaborations. And with that, I will say thank you.
All right. Well, everybody's on mute, but you will be hearing applause for sure. And I think that on some level, you're preaching to the converted. On the other hand,
yeah.
You just gave a master class on communication, on how important it is to be able to translate some of the research that all of us do into what it really means. And it goes not only to the statistics, but also to global populations, and also to the human experience. One of the other giants that I'm a great admirer of, Jack Geiger, who passed away last month. One of my favorite quotes of his is that statistics are human beings with the tears wiped away. Yeah. And this is where we are. Anyway, now's the time for some questions. We have time. And you can just unmic yourself and try to say something, or raise your hand. I'll try to get to you, or put something in the chat box. But I'm going to lead off by just, as you're preparing your questions, by asking Phil to tell us a bit more about the Global Pollution Observatory and what sort of things you have planned and what sort of projects they're doing now.
Yeah, no, I anticipated you might ask that question, so I threw in a couple of extra slides. So we've done several recent studies, and we've got more on the drawing board. I mentioned the study we just published in December on air pollution in India. The average concentration of 2.5 in India is 91.7 micrograms. Remember, the WHO standard is 10. And over 90% of the population of India lives in areas that exceed the WHO standard. We calculated the number of deaths, 1.67 million, of which about 60% is due to ambient air pollution, and there's still a big household air pollution, although household is going down, thanks in no small measure to the good work of Kurt Smith, another giant whom we just lost. But ambient is rising, and we did economic calculations. When you put in healthcare costs, which I don't show here, it's about 1.5%, 1.6% of the GDP. Huge variation across the states, and that's important because in India, just as in the United States, state governments have a lot of power to allow or control pollution. And so we're in the process now, as we wrap up the aftermath of this report, we're putting together state by state by state profiles so we can inform the governor and the legislature in each of the Indian states how big of a toll pollution is taking there. And the general pattern is that the heaviest levels of pollution are in the north of India, where you have most of the industry, and also the air mass is pushed up against the Himalayas. It's a bit like LA, where the air is pushed up against the mountains. And down in the southern part of India, where you have the crosswinds across the subcontinent and also less industry, the air is much better in places like Chennai. And so one of the tricks is to take advantage of the notion that all politics are local and present that data at the state level. And the recommendations are pretty much what I've just rattled through a minute ago: leadership, clean energy, city planning, etc. Another study we've just done is a big study of ocean pollution and human health that was supported. We did this in collaboration with the Scientific Center of Monaco, and it was supported by Prince Albert of Monaco and his foundation. We had a group of about 45 people from 18 countries who did a very comprehensive analysis of ocean pollution and its impacts on human health. And The bottom line is it's a big problem. It's been very inadequately studied. For example, we did not include it in our 2018 Lancet paper at all. But it consists of plastic, which is the part everybody's heard about, mercury and oil spills, and pesticides and nutrients, which is agricultural runoff and manufacturing chemicals. It's a whole soup. Heaviest near the coast, not surprisingly, but it spills out into the deep ocean. And it comes back to bite humans. So the mercury goes back in tuna fish. When we, and the major source of mercury that a lot of people don't recognize is coal-fired power plants. All coal contains mercury. When you burn thousands of tons of coal, the mercury vaporizes, goes up into the atmosphere, travels, and eventually washes down into the oceans and then accumulates in predatory fish like tuna, swordfish. And if a pregnant woman eats that mercury contaminated fish, the mercury passes through to her infant in the womb, and they have loss of IQ and behavioral problems. And then the plastic waste breaks down into microplastic particles that still contain within them all the little chemicals that are in the plastics that we know and love, everything from phthalates to bisphenol A to flame retardants, heavy metals. And those microplastic particles, just like mercury, move up the food chain. We basically tried to paint a picture showing that ocean pollution is not just something that's out there over the horizon where nobody can see it, but it actually has impacts on human health. And we argued that, like air pollution or other forms of pollution, it can be controlled because 80% of it originates from the land. And then finally, I hope I'm not stealing Howard Frumkin's talk for next month, because he and I did this thing together, but Howard and I had a piece in January of last year in the New England Journal, a perspective piece, 2 or 3 pages, on the false promise of natural gas. What triggered this was I got really pissed off. I got really angry when one of the pipeline companies called Enbridge, the same people that are trying to build the Keystone pipeline, decided to put this natural gas compressor station in the town of North Weymouth, Massachusetts, which is just below Boston, right on the coast. If you look on the left-hand side of the slide there, you can see salt water. That's an arm of Boston Harbor coming in. You can see it's very close to houses. You can see the houses behind the plant. It's an environmental justice community, 46% minority, low income. And they snuck this thing in during the Trump years. But fortunately, we've stopped it from opening. We've mobilized a coalition of community leaders and scientists, something that John Prines taught me how to do a long time ago. And so far, we've kept them from opening the thing. And we're hoping now with the change of federal administration that we may be able to turn this thing into a theme park. That's our hope. But anyway, it triggered Howie and me and our observatory to write an editorial, and the conclusion is that natural gas is not a bridge fuel at all, but rather a bridge to nowhere. So that's some of the stuff we've done in the past year and a half.
Fantastic. Okay, questions. I see Rob McConnell's mic is off. Maybe he has a question. Rob?
So Phil, I was going to ask you, you've answered part of my question, but I was going to ask you about this the strategy of the gas industry, which we've seen. It must be a playbook that they're using across the country locally. And here in Southern California, there's a big push to do exactly what you described in the Northeast and sort of globally, and that's to package natural gas as a clean transition, and they've been, I think, fairly effective here, and
it's been effective in a lot of places. It's a well-honed story.
Yeah, and they've co-opted some environmental groups that I thought were good groups before this happened, and they've sort of positioned these people to champion their cause. There's a group called Breathe LA that's like a respiratory health children's group. The Coalition for Clean Air here has signed up to this. I wonder if you have any thoughts from your experience about lessons that are transferable
Yeah, well,
in terms of what you did to stop this? This is on a much bigger scale here, but probably bigger scale in Boston as well and other places.
yeah. So the play, you've got the playbook exactly. Another thing that they don't talk about, and it took me a while to realize this, is where that gas is going. So here in New England, where we have cold winters, the pitch was, oh, this gas will meet the energy needs of New England. It'll help you next January when you're freezing your butts off in Boston. Well, that's a complete lie on two counts. First of all, almost none of the gas that's going through that facility is destined for New England. Almost all of it will go either to the Canadian Maritime provinces or New York. And secondly, when it gets to those destinations, for the most part, it's not going to be used to heat homes. Instead, it's going to go into the manufacture of plastic. This is one of the big things that I think the environmental community is just waking up to, and the academic community, is that we have such a glut of gas around the world, and most especially in the United States these days, that the fossil fuel industry has had to find new markets for their gas. And electricity generation is not going to be a long-term market. Gas-fueled cars is not going to be a market, especially now that GM has made their recent announcement. So where's this gas going to go? And the phrase, the European Greens have come up with the phrase that plastic is the fossil fuel industry's plan B. And so what the natural gas does, it goes to these factories called ethylene crackers, which breaks it down to these 2 carbon molecules. And then that ethylene can go in any direction. It can make any plastic at all. And so that's where the natural gas is going. And they're working very hard to ram this stuff through before people wake up to what people and citizens and regulators wake up to what they're doing.
We have a question from Sophia Greskin, the director for our Institute for Inequalities and Global Health. Sophia?
Hi, thanks. I super appreciated your talk, and I really appreciated your emphasis on political will to make change happen, even when the science is clear. And I wondered if you could talk a little bit about your experience with countries around the world, and if there's some key factors that you can point to that can generate political will to address climate change. I'm thinking about, are there lessons to be learned working across countries, or is what's needed unique to individual localities?
Yeah, well, I'll tell you a story. One of our really bright undergraduate at Boston College, who also happens to be on the varsity baseball team, is doing a little study in our Global Observatory on Pollution and Health, where he's looking at the nexus between air pollution and death from cardiovascular disease in Eastern Europe and the former Soviet republics, Ukraine, Poland, and the other countries. I think it's 7 countries altogether. And first of all, they've got a big problem of air pollution there and a big problem of cardiovascular disease. And then he came up with a very interesting wrinkle, which I think has direct implications for your question, Sophia. And that is, he took advantage of the fact that there exist on the market indices of corruption. Political scientists have ranked countries around the world in terms of their corruption. They have various metrics that go into it. There's several different scales. They agree in broad strokes, not in every detail. Anyway, what he found was this striking correlation between the index of corruption in the country, the level of air pollution, and the level of cardiovascular death. I think it just speaks to the, it's not published yet, by the way, it's coming out, but it goes back to this point I was made towards the end of my talk, that as levels of inequality rise in a society, which usually translates to corruption in one form or another, legally sanctioned or not, as inequality rises, pollution rises, the release of release of greenhouse gas rises, because there are people at the top who are making big bucks in the short run by allowing those things to happen. And it's only when you narrow the economic gap between rich and poor and have more participatory democracy that you begin to create political structures that enable societies to get a handle on this stuff. I know that all sounds pretty theoretical, and I suspect in a lot of countries it's not terribly feasible in the short-term future, but I think it's a reality that has to be recognized.
More questions for Phil? Tell us about plans for a follow-up to the Lancet Commission. I understand something's in the works.
I'm sorry, I didn't hear you.
Tell us about the follow-up to the Lancet Commission.
Oh, okay. So you're part of it.
Yeah.
So we had a meeting up in Seattle, March of 2018, I believe. Howard was there and I was there, and we the starting point was the recognition that the BBD methodology is inherently conservative, that it misses certain exposure disease pairs. What could we do to ensure that the GBD captures more pollution-related disease? And we put together a whole research strategy. The writing was led by this lovely young woman named Rachel Schaffer, who was at that time a graduate student at UW. I'm not sure where she's gone. I don't know, Howard, if you do.
Oh, Rachel's at the EPA now. She's working for Chris Thayer, and we're still working together.
She's in a good shop then. And anyway, the paper was published in EHP, and we laid out a whole research agenda of studies that we thought to expand knowledge of connections between various pollutants and various disease outcomes, which would in turn lead to the incorporation of these exposure disease pairs in the GBD analysis. So that's the short of it.
Andrea and John.
I have a question, Phil. Is your group at Boston College looking at connections between COVID and pollution? The New York Times had a great interactive map this week of LA County showing the areas that have the highest, I think it was cases and maybe not deaths, but you know, a large number of those areas are very poor and Latino or Black, and a lot of people living in the house. And so there are a lot of, you know, and maybe they're essential workers, but a lot of the areas that are darkest on the map, being the worst, are ones that are in the most highly polluted parts of Los Angeles, you know, from the kind of like from where the trucks travel, from the ports up the 710 freeway and out. And so I'm just wondering, I know that a few people publish on COVID and pollution, but I'm wondering if that's something you guys are looking at.
So we've not done it ourselves. We've been following it closely. Francesca Dominici, who's our neighbor at Harvard School of Public Health, led a team that did an ecological study looking at the correlation, and they found a positive dose response relationship between particulate air pollution and fatality from COVID-19. Earlier this afternoon in the faculty meeting, I guess it's morning for you, earlier today in the faculty meeting with your group, I was talking with Frank Gilliland, and Frank tells me that he's doing some very good work out there. Frank, I don't know if you're on the call or not now.
Yes, yes.
Using the Kaiser Permanente data to look at this. So it'll be, there's Frank. Okay, so it'll be very exciting to see when that data comes out, but we've not done that work ourselves.
Thank you. And also John wants to say hello.
Hello, John.
We miss you.
Yeah, same.
It's worth following up Andrew's question. We created a Center for Pandemic Research. In fact, Frank is the PI. And among the things we will be focusing on is our pollutants, not only because the pollutants are pulmonary immunotoxicants and can amplify the inflammatory response to COVID, but because, as you're probably aware, Phil, there's really good data showing that certain contaminants will lower the immune response to vaccines,
Right.
including things like PFAS and mercury and others. So it's a really important question, particularly since everybody's thinking the vaccinations will cure everything. Well, they may not.
Exactly.
And there may be a good reason for that.
Another thing with USC is that many of the, in the community outreach program, many of the environmental justice groups that we've worked with over the years and that Jill Johnston continues to work with are in those communities that were so dark on the New York Times map of LA County and COVID. So
I'm
a lot
sure
of
I'm sure there's multiple factors contributing to the high mortality in those communities. I think it's logical to think that air pollution is part of it.
exactly. Thank you.
So Phil, I have a question for you. You've done a lot of work sort of informing and working with the politicians to sort of move environmental legislation and so forth forward. It seems like so much of the environmental health, all the issues are often tend to be a case of catching up. You know, we're always sort of behind the scene, you know, behind the proverbial activities. We release chemicals, we do things, and then afterwards we have to figure out and sort of clean up the mess. And so I wonder if there's any way, you know, how do we break that sort of that endless circle of always chasing instead of being at the lead? You know, the European Union has tried different ways in terms of the REACH program, rather being more proactive. It's not quite gotten the traction in the United States for these sorts of, you know, more safety first sort of approaches. But how do you see this sort of improving?
Yeah, no, it's a long story, right? It's a recurrent story. I mean, virtually every major piece of public health legislation you can think of has been written in the aftermath of some disaster. So the Clean Air Act was after the Denora, Pennsylvania disaster. The Clean Water Act after the Cuyahoga River caught fire. The Superfund legislation after Love Canal, and the list goes on. You'll recall that we came close to, we actually did pass rational chemical policy in this country in 2016. There was bipartisan legislation, believe it or not, with Senator Vitter, Republican from Louisiana, and Frank Lautenberg, Democrat from New Jersey. They passed this bill, which has subsequently been named the Lautenberg Chemical Safety for the 21st Century Act, which was pretty closely modeled on the European REACH thing, and was supposed to put in place a whole series of safeguards that would require that chemicals be tested that new chemicals be tested before they be brought to market, and that existing chemicals be tested for safety and toxicity, beginning with the worst first. And that was just getting off the ground when the occupant of the White House changed in January 2017, and predictably, nothing has happened. It'll be interesting to see if the new administration resurrects that legislation, which is still very much on the books. The Trump people didn't try to undo the legislation; they just didn't do anything with it. So I'm curious to see how that plays out.
We have a few more minutes. I see a hand up from somebody named Collins, but I don't know who that is, but please ask your question.
Yeah, this is Mike Collins, and I noticed that there was a great deal of negativity about a nuclear option, and I'm wondering if that also applies to fusion as a potential energy source.
I don't feel comfortable answering that one because I've just not thought in an organized way about fusion. I don't even have a sense of how close it is to being a reality. So I'll have to take a bye on that. I'm sorry.
Yeah, there are several plants that are being built in France and in other places where they're going to use fusion in the future, the near future. So.
And you mean nuclear fusion?
Yes.
You know, so, I mean, some of those, even though I haven't thought about it in any detail, I would argue that some of the same intractable issues that surround any other nuclear plant apply there. The biggest issue, the unavoidable issue, is that of nuclear waste. Any plant that uses fissile material produces nuclear waste, and nuclear waste has to be safely stored. It has to be protected against theft. In other words, there's security issues. And even in France, I don't think they can get around those problems, no matter how well designed the plants are. You can design the hell out of a plant and reduce to 1 in 10 billion the likelihood that anything bad is going to happen in the plant. That's an engineering issue. But you can't avoid the problem of waste. That's inevitable.
What kind of wastes are associated with fusion?
I'm presuming, I don't know. I mean, I haven't studied fusion, but I'm assuming that nuclear waste comes out of it, just like from a reactor. Correct me if I'm wrong.
My understanding was that it was fairly clean, but I guess I don't know the details, so
That's an important thing to, this is an old reference, but sometimes old sources are still good. Back in 1975 or 1976, there was a Royal Commission on Nuclear Energy that convened in England. And they published 6 volumes. It was a massive piece of work, the kind of thing that only the Brits could produce. But at the end of the day, they said, listen, the nuclear option is not in Britain's future for 2 reasons. We don't know how to deal with nuclear waste, especially in a small country like England or the UK that didn't know where to put the waste. I suppose you could always send it over to Ireland. And secondly, they were really worried about the notion that heavy investment in nuclear energy with all of its infrastructure would necessitate the creation of, I think they called it a plutonium police force, troopers whose mission in life was to protect the nuclear infrastructure, which would inevitably lead to the creation of a security state. And they said the combination of the environmental risks and the social risks was just too high, and that Britain shouldn't go the nuclear route. And except for 1 or 2 old reactors that predated that report, Britain, very much unlike France, has not gone big into nuclear energy. France, on the other hand, is deeply invested in nuclear.
Folks, it's 1 o'clock. I want to express my appreciation for Phil for this illuminating talk and a great discussion. We hope to see you back out here in person so we can do all the fun stuff you're supposed to be able to do in Southern California. Gosh, we'll be seeing you in any case, I'm sure, in the public sphere. Everybody, thank you very much for attending, and we'll see you at the next one.
Good to see all of you. Thanks to Howard, to Ron McConnell, to Ed for having invited me, and to Vivian and her team for having done the logistics. It was great.
Bye-bye now, everybody.
Thanks.